Sources of gear are legitimate. There are lots of them out there that are not. Certainly a number of Chinese manufacturers have sprung up that are not approved by the FDA and are not legitimate. We're being offered things from all over the world, and so our team has to be very careful about vetting each potential distributor. We have found masks in all different kinds of places, both the traditional American N95 mask and the KN95 mask, which are a little bit more abundant. That's the Asian version of the N95. Looks a little bit different, but still works. So praise and thanks to our team in materials management for the creativity that they've shown in helping us to find all the materials that we need to keep our staff safe. Now, speaking of remaining safe, I'd like to call Kit Bredemus to the podium. Kit is Vice President and Chief Nursing Officer, and he has some tips to share with you about the use of cloth masks in the community. Kit?
Thank you, Russell. Hello. All right, so I'm going to be talking about cloth mask usage, and I know that there's a lot of questions out there about what constitutes a cloth mask and what we can use to protect ourselves out there. I'm going to go over two different types. One is the simple loop mask, is mainly what we're seeing now. This is made from one of our volunteers that have donated to the hospital. And the biggest points to remember is that this is all about source control. This is to prevent you from coughing, sneezing, and protecting others from you spreading the disease when you may not know that you have it. There is asymptomatic transmission. So the main point of this is to help in situations where you have to be out in public and where social distancing is going to be a challenge. So first I'm going to show the simple loop mask. One of the biggest things to remember is to wash your hands. Before you touch the mask and before you put it on, you need to clean your hands. You'll put the mask on, wrap it around the ears, and it can be a little hard to hear me, so I'll try to get really close to the microphone. Once it's been looped, then you'll make sure not to try to touch the front of the mask. You'll just make sure you have a nice fit around the sides. So you'll see that it goes firm against the face, and it just covers the mouth. It doesn't have to cover a massive expanse, just the nose and the mouth. When taking it off, again, I'm going to wash my hands and take it off without touching the front of the mask. If you choose to make one with ties, that's another option. You'll start, again, with not touching the mask itself. You'll hold it by the ties. You'll start with the top ties first. And then you'll move down to the bottom ties. And again, it doesn't have to be very tight. It just needs to be firm against the sides of the face here. And again, it's just covering my nose and my mouth. When taking it off, it's going to be the reverse process. You're going to start with the bottom tie first. That way the mask is still covering, it's not folding down yet. And then you'll take off the top ties and remove the mask like so. Again, not touching the front of the mask and not messing with it and rearranging it a lot. That's, again, one of the main modes of transmission is going to be from hands, from soiled hands. So making sure that you're not constantly touching your face, touching your eyes, and adjusting the mask. You'll keep it on until you need to take it off. So we also don't want to see wearing it around the neck or anything like that. That doesn't do any good. It's going to make sure that you keep it on until you need to take it off. A few other things I want to just mention. It is not recommended to put a mask on a child under the age of 2. Babies and infants don't have the ability to remove the mask if they're having trouble breathing. And then if you've ever tried to put a mask on a 2-year-old, they're going to touch their face 10 times more when you do that. So again, it's going to make sure that you are just protecting them from being outside whenever possible, or protecting from being in public groups. You can be outside. In this setting right here, we wouldn't necessarily need a mask if we're more than 6 to 10 feet apart and we're in a pretty spaced out area where the wind can carry droplet particulate. Also in cleaning these, when you have a mask, you need to make sure that you keep it clean. This can be done daily by just simple soap and water. You can put it in the washing machine and dry it, or you can even wash it by hand. Please do not microwave these. If you microwave a mask, I know that there is a post on social media that talks about microwaving masks. This poses a fire hazard. They will catch on fire, and then you'll have a lot bigger issue to worry about. So just washing, you can air dry them, or you can dry them on low heat in the washing machine. So with that, I'll open to any questions, if anybody has any questions. Okay. All right. And not having any, then I will toss to Becky with the Health Department.
Okay, sorry, I do have one question.
Yep.
If you were to give us a number on how many donated masks you've gotten, what's that number?
That is hard to say. Right now, our staff are also making masks, and we're anywhere to the 200 to 500 a day range with that. But then we've also had our volunteers donate about 2,000, somewhere in that 2,000 mark.
Okay, great,
Thank you. All right, thank you.
Good morning. I'm Becky Smith with the City of Midland Health Department. I'm reporting numbers, which some of you may have realized are also on the City of Midland's web page, and we update those as soon as possible every day. As of now, we have total confirmed cases 27. As far as the source of exposure, we have 12 that are travel related, 12 that are a contact to a known case, 3 that are community transmission, and the gender of cases, we have 13 that are male and 14 that are female. The age group of cases, 0 to 19, we have 2. 20 to 29, we have 12. 30 to 39, 5. 40 to 49, 2. 50 to 59, 4. And 60 to 69, 2. And none above that. As far as isolation status, we have 9 that are at home still in isolation, 2 that are in the hospital in isolation, and 15 that have completed their isolation. As far as where they were tested, their medical visit, we have 13 that were tested at the Midland Health's drive-through clinic. I apologize, too much paperwork. We have 6 that were tested at the clinic at a private clinic, 6 that were tested in the emergency room, and 2 that were tested as inpatients in Midland Memorial Hospital. As far as the investigation status, we have 24 that are ongoing and 3 that have been completed. And then as far as deaths in Midland County, we have the 1. Any questions?
Yesterday, Edward County's Health Department announced that they're partnering with UTPB nursing students. The nursing students are going to help the Health Department go over those investigations, tracing where these positive cases might have been in the community. Is that something you guys are looking into?
We have actually been offered by Midland Memorial Hospital for help from them if we get to the point that we need that. And we're not to that point as of yet. I have a staff that's very well cross-trained that help with investigations on a normal basis. And so we're not to that point as of yet, but we have been offered by Midland Memorial for help if we need it.
And then Ector County Health Department also said that they've traced, they've had 30 confirmed cases, but they've reached out to more than 200 people who might have been in contact with those positive cases. How many people would you say you guys have reached out to who might have been in contact with your positive cases?
I do not have that number just off the top of my head, but it is something we could work on and get if that's something the media is interested in.
Yeah, that would be great.
Okay. Anything else? Okay. Thank you.
Thank you.
Good morning, I'm Orlando Riddick, Superintendent for Midland ISD. I want to share just a few items with you. Coming in today for Tuesday, April 7th, we are into Phase 3, Day 2 of what Phase 3 looks like. Phase 3 is bringing your teacher to you, so bringing the classroom to the home, so to help a number of parents who are certainly having a struggle at this point in time, trying to navigate either multiple students, work and students, to know that you have now your teacher available to you. We have a platform that has been launched, which is midlandisd.net/at-home learning. That's midlandisd.net/at-home learning. It provides an array of the resources that are coming to you via the Google Classroom. Google is our platform of choice for families, so we've navigated everyone to that platform to ensure that we can continue the learning process from this point until the point that we either return back or we actually continue. So at this point, right now, I would share for parents, if you are having a difficulty around a device, we've issued out over 600 devices to our community members that you reach out to your campus principal or to your teacher so that we can ensure that as we set up the Google Classroom, we know who has a device, and it's device agnostic, meaning any device that you can use can operate the classroom itself, whether it be a smartphone all the way going to a Wi-Fi TV. If you're struggling around Wi-Fi as well, to call the campus principal or your teacher so that we can get you the information available through that resource. We have a number of providers in our community that are offering 60 days free Wi-Fi, so that's a utilized resource to certainly attack and go towards if Wi-Fi is a concern that you have in your home as well. With that, I will take questions.
You mentioned last time that you were just started talking about the possibility of extending into summer with different.
Well, we always extend in the summer. The question is about, the possibility of extending into the summer. So every year we do extend into the summer. We call it summer school.
Right.
We're going to have to think through what summer learning could look like at this point in this juncture. And what does it look like as we begin to get kids at this point for the platform, and those who are driving it really well and those who are still having a struggle? What could that look like as we enter into the 2021 school year? And seeing where we might be in this environment, what 2021 could look like at that point in time. But summer learning is something that is going to be on the radar. We're in phase 3. That puts us, we still have to get through a phase 4, and phase 5 would be what that summer learning environment could look like for our community and those kids that we know that we need to get them back in.
Last week you mentioned creating a hotline that students can call into.
Correct.
What's the status on that?
I don't have that right now, and I appreciate you asking the question about the hotline that takes care of mental health for both our teachers and for our students. That hotline is set up with our counseling staff that goes 7 to 7, and then Primary Care takes care of anything 24/7, and they can escalate what concern can be to a greater professional, if you will, to handle that need. I don't have that, but I'll certainly get that out so that we can share that back with you.
And then the status on the Wi-Fi buses and ordering the hotspots?
So hotspots, I don't believe they have come in. They were scheduled to come in on Friday. As the last check, I haven't heard that they've come in as of Monday, but I can get back with you on the hotspots that we've ordered. We've ordered over 1,000 of what that could look like for our community to help spread what that resource can do for those kids who are navigating the Google Classroom. The buses are set. We've identified in our community through surveying and we've GPSed all of our students who need some type of resource in regards to Wi-Fi, knowing that these are individuals who could either get through Suddenlink or other providers that we have in our community. That's just one. Whether they need a device or whether we push a bus into that community. So bus would be the last resource. I'd want to rather get you something in your home, and then the bus becoming the last resource that we have. And we have outfitted 5 buses. We have 5 that are outfitted with Wi-Fi that could support that need.
And if you could give me a ballpark as to how many students are in need of that, how many?
I don't have that number, the total number of kids who do need the Wi-Fi resource. I could get that number to you. I just know I've seen the GPS map of where they're located throughout the city, and I haven't counted what that total number is.
Where would you say majority of the students are located?
That would be outside of the greater area, right? So that push into the county. So if you just take a circular circumference of the city and go broad, that's where that concern could exist. Not that we don't have any in the center of a city, but yeah, that's the majority of where that would fall in. All right, thank you.
Terry Johnson, Midland County Judge. I want to Number one, I want to thank Justin Bunch with our United Command initiative. There's a lot of information that goes on behind the scenes, and we get literally, I probably get 20 emails a day with updates from all kinds of different government entities. Some of those updates will be 17 pages long, so we're digesting all types of information to develop contingency plans for our area. Justin's in on that. And making all those things happen. We're planning for the worst and we're hoping for the best, but we'd rather have a good plan in place and not need it than vice versa. I would like to also take this opportunity to thank all the medical staff who are doing what they're doing, being away from their families, putting themselves at risk to keep us all safe. So I want to give a big shout out to those folks. And then just to the regular citizens of Midland County, I know this is dragging out and it's starting to get old, but now's not the time to give up or to lose hope. We're probably going to see the peak this month. Now's not the time to give up. Hang in there, keep doing what we're doing. If you're doing what we're asking, thank you so much. If you're not, we ask that you start following the protocol that you're hearing from the medical professionals. You've got the ability to adapt, and so please use that ability. And then in closing, I'd ask that we all support each other. And the main thing is our small businesses. In this time, our mom and pop businesses and our small businesses are going to be who also take a hit on this. So if you can use curbside, if you can use takeout, if you can support a small business in any way that's a necessary business, please do so. Other than that, that's all I got.
Good morning, you guys. Good to see you. I was just made aware by MISD with a question you had about mental health. You want the phone number?
Yes.
432-240-1439. 240-1439. And so thank you again for being here this morning. I'll keep it brief. First of all, I just want to say thank you to our community. I think our community is continuing to do the things that they have been asked, just as Judge Johnson was talking about. Even driving around this past weekend, seeing what people are doing in the stores, seeing how every store has done everything they can to protect people as much as people will allow them to be guided and directed. I would reiterate what the judge has said, which is now is no time to loosen up. Even though everybody still might be thinking, when is this going to come to an end, we need to continue to push and continue to sacrifice. We need to continue to stay at home and to stay safe and just really continue to support each other. And so with that, about the only thing I can report to you from the city, the council is meeting again today. We are meeting every single week pretty much, discussing any changes we need to make. We don't see anything in the making today as far as restrictions or anything we need to do to change anything, other than continuing to encourage the community to do what they're doing, to practice their social distancing, to only have one person go to the store rather than a family of 10 going to the grocery store and different things like that. And then today and in the days ahead, I'll be on calls with members of Congress, members of the Senate, members of the House, discussing all the things we might be able to do with the Small Business Administration and others. I was on a call just this morning. And so really we're spending a lot of our time and a lot of our effort working with Washington, D.C. right now that there are stimulus packages and different things that are available. We need to make sure we're on the front lines. I'll be on a conversation this afternoon with the Department of Energy as far as what they need to do and how they can help us here in the basin. So really where we are as a city is continuing to support what we have to support for our health and well-being, and we're kind of turning a page here with the city and getting ourselves ready to help our citizens who are going through such a difficult time, and seeing how we can mobilize the resources to make sure they get here to West Texas, because oftentimes they don't get here to West Texas like they need to, and we could argue we're being hit harder than just about anybody else economically and physically, with the exception of places like New York City and San Francisco and other places. And finally, just as a note, I'm trying to encourage everybody this Monday, Thursday at noon just to stop. And maybe we as a community can stop at noon, whether it takes you 2 minutes or you take the whole hour, just to pause and pray for our community and pray for one another, pray for our healthcare providers, and just remember in this Holy Week the sacrifices we're making and the example of the sacrifice we can follow. So with that, any questions? Stuart?
What does it mean to you to have Midland behind other similar sized, larger populated communities like Lubbock, the Amarillo region, even Abilene, Odessa, in terms of the number of corona victims? What does it mean to you that Midland's doing right?
Well, I think that's a great question, Stuart, in the sense that when I look at where we are as a city, I think it demonstrates a number of things. Number one, I think it demonstrates what we said about our people all along, that our people, you give them a challenge, they're ready to take it. And I think the citizens of Midland saw this a little bit of as an invisible thing, and maybe it wasn't something we should take seriously, but they began to listen to the information, and finally they said, okay, we'll fight. And I think when we put it in terms of a fight, our citizens respond to that. As far as our entities and our governmental entities, I don't know if there's a region or a city in the region that has come together and partnered as well and as fast as we have. And so Justin has been a huge part of that, helping us get this together. And everybody has really just rallied around each other. And what can we get you? How can we help you? What can we do? And so I think once again, Midland has displayed itself as a shining light in the middle of the basin. And we can be thankful also, I think, for our weather and the fact that, thank goodness, it's just going to get hotter, and maybe it can get up to about 120 and bake all this off for all of us here pretty soon. But really the simple answer to that, Stuart, is our community knows how to rally around something when it's real. We're a little slow to believe it at first, but when we do, we get after it. Anything else? Thank you all.